I'm Steve. As you know, I'm here with Dr. Nario of Biointegrative Health Center in Reno, Nevada. You can check him out online. Thanks for being with us, Doctor.
Hi, Steve. Always a pleasure. Thank you for having me.
So we're going to talk about who knows a lot of things kind of today, and we'll kind of use me as an example because I did this recently. You asked me to do it. You did a therapeutic phlebotomy for me, which is basically just taking blood out. And then we can kind of get into the differences of that and what you're doing and giving blood, which giving blood is good, right?
Definitely, Steve. Therapeutic phlebotomy is, again, another term for that would be bloodletting or venesection, and can be done in physicians' offices, hospitals, and blood donation centers. And it's basically almost similar to donating blood. In the past, how they treat disease in a barbaric way, because they believe that the
George
illnesses,
Washington.
right, it's because the blood is dirty and it has all these toxins, all the substances to make you sick. Well, they were doing bloodletting to think that all these illnesses can be cured until they found out that everyone was dying from hypovolemic shock. And that's the end of that. Well, it's almost the procedure is almost just simply just putting a needle on your vein, and usually on the elbow, which is one of the bigger veins that we have, and removes blood and be collected in bags. And typically around 450, 500 ml or a pint is removed at a time. But again, this is something that we do with blood parameters, and we monitor for hematocrit, which is the concentration of your red blood cells, and even iron, such as ferritin, to measure iron stores, and even your hemoglobin, which are the carriers of oxygen.
Okay, so my hematocrit was a little high, a couple points high. My ferritin was normal. I'm on testosterone replacement therapy. I'm on as you know, you're my doctor, and I'm on a very low dosage of testosterone, 100 milligrams, just so everybody kind of knows where you're coming from as you're advising me. So, why did you want to do this treatment for me?
Right. Well, Steve, again, basically indications of therapeutic phlebotomy. Majority of the reasons out there are more of genetic. And this is because we have a genetic trait that makes us create a lot of red cells. This is called polycythemia, again, which thickens the blood. And now we're afraid of clotting. And same for hemochromatosis. I think we mentioned about iron. That's another genetic condition that can now lead to high iron that can deposit in vital organs such as the heart and liver. And of course, phlebotomy removes the extra amount of that from our systems. And a very rare one, porphyria. But again, it's really related to removing iron. For you, that is what we call now the other classification of acquired increase in blood cells, specifically red cells. And when we use this term, it's called polycythemia. So being a testosterone replacement does this, especially if sometimes the dosing you're still trying to find dosing inappropriate measures. It's like a pattern that you see. And usually what we do for testosterone therapy, we look at hemoglobin and also hematocrit. So hemoglobin, again, is almost at the level of 18 or higher. That's when we think, phlebotomy should be needed. Hematocrit of greater than 54, that's also another parameter. And again, it's a temporary measure while, again, we're trying to find a better dose for you or how your body's metabolizing testosterone. And usually men on testosterone therapy, not all, develops this polycythemia more in the injectable population rather than the cream. So there are usually two forms there. And that's why you're on the injectable. And again, why are we worried about this? Because high blood viscosity increases the risk of potential vascular complications such as coronary, cardiovascular, and peripheral vascular problems such as heart attacks and strokes.
Okay, so what is the difference between going and donating blood and the phlebotomy treatment? I mean, and I have a lot of questions on this. So I mean, it's obviously good to donate blood, right?
Hmm.
Because, you're helping people that may need blood, but how often can you do it? I mean, you can't just go do it every other day, right?
Right.
What is it? Once every 3 months, or how often do they let you donate blood?
Right. For blood donation, we recommend every 2 months. You can do that for a whole year, especially if you're donating whole blood. So that's the specific recommendation that we do.
Okay, so before we get to the next one, what would be the benefits? What would be the physical benefits for someone who's giving blood? Not just that they're giving the blood, but
Mhm.
would there be any benefits to them, or would there be any harm to them potentially by doing this?
Right. Well, when you talk about benefits, really, when you remove blood, it's almost like a reset of the body. When you remove blood, of course, what's going to happen here is you're going to stimulate your bone marrow to create new cells for you. And that's why now it's a proper way of renewing and removing old blood cells that are in there, defective ones. And also, when you remove blood, it has also, there are actual studies for this, that when you remove blood, you help enhance the detoxing potential of the body, especially with your liver. And this was found in studies that were actually looking for the decrease in levels of like pesticides and chemicals such as perfluoroalkyl. And these are what we call, like, again, the chemicals that actually is involved with reproductive problems, lowering down immune system. So that's why it's a form of detox as well. And that's what's special about what we do. We emphasize on that, not only just because we want you to donate blood for, of course, people in the hospital, for example.
Okay, that's interesting. So it's a good idea for people to go give blood at least periodically. So tell me now, what is the difference between just going and giving blood and the treatment that I had at Biointegrative?
Right. Well, as we all know, Steve, and also I guess referring back to your question, that you said that what are the disadvantages of phlebotomy? So now there is also a chance that by removing one pint from a patient, you can now also lower down the blood volume. That's again what dehydration, hypostatic, orthostatic hypotension, and that's the reason why after we do a therapeutic phlebotomy, this is something that we replace with fluids afterwards, such as saline, lactated ringers, some vitamins we also give. So that's why after that effect of removing, we replace not only with plain fluids, but powered up hydration fluids with vitamins and nutrients that can perk somebody up after losing that much blood in the system.
Okay, that helps. So what I'm kind of getting from you is it's probably a good idea for people, if they qualify to give blood, to do it maybe at least once a year, right? Because it's kind of a reset. It can help detox and all that. So that's not a bad idea, right?
Actually, Steve, every 2 months, that's something that you can donate. I guess do
They
donation
could,
for.
but would they get a benefit if they did it once in 8 months? Would they still get some
They
benefit?
still will, of course. They
Okay.
still will.
Well, that is very helpful, Dr. Nario. That's Dr. Nario, Biointegrative Health Center in Reno, Nevada. Thanks for being with us.
Well, Steve, thank you again. As we all know, knowledge is power, and thank you for letting me provide you with the edge on longevity and health maintenance, which I call the biological edge or the bio edge.